Hello, Monica. I think whatever the link Motoshi sends, no, that is Zoom, what to say, YouTube link. So they are waiting there.
It is actually posted on JHP Midwifery and Nursing. I was just looking at the thing. No, it will get onto the YouTube live in some
Monica,
time.
you're live now. So, yeah.
Whatever the link Motoshi sends, no, so they are waiting there.
So, is anyone live now? Motoshi, can you confirm? Yeah, so I can't see the live link right now, right? So, Monica, I think you can start now. Okay.
So good evening to one and all gathered here, the ones who are watching it live and the ones who may watch it sometime later. So I'm Dr. Monica Rita Hendricks. I started off by doing my BSc nursing, after which I worked as a staff nurse for a year and a half. I then worked as a clinical instructor for the next 6 months. I went on to pursue my master's in obstetrics and gynecological nursing. And after which I joined in as a lecturer. I got promoted to an assistant professor and associate professor. So I am a Johnite. I've done my entire education and my career was with St. John's. And I've spent about 18 years at St. John's National Academy of Health Sciences. I've also pursued my PhD in neonatal nursing. And my area of research was effect of nurture intervention on the neurodevelopmental outcome of preterm neonates. I've also completed a fellowship in pediatric bioethics from Children's Mercy Bioethics Center from Kansas under the University of Missouri, USA. And I was an adjunct faculty with the Health and Humanities section of St. John's Research Institute. And recently, I've joined Jhpiego, and I am a senior program officer in nursing. And I work under the UPTSU nursing project. So that's a brief introduction about myself. So I'm here today to speak about what is beyond nursing. So traditionally, we all think that once you pursue BSc nursing, the only thing that you can do is be a staff nurse. Or if one does not like the shifts, the morning shift, the evening shift, the night shift, and since nursing is predominantly a woman's profession, I know it may sound a little discriminatory, but the stats in India at least show that majority of the people who pursue nursing in India are nurses. So people try to be safe by to pursue MSc nursing so that they can stick to a 9-to-5 collegiate job. So, but nursing is not confined to only the bounds of the hospital and the bounds of college. There are a lot of opportunities for a nurse who has completed a BSc, a nurse who has completed an MSc. So I'm here today to orient you and keep you aware of all the things that a nurse can possibly do. So as you are all aware, once you finish your GNM nursing or BSc nursing or MSc nursing, you can get into the clinical line of work. So you become a staff nurse, you become a ward in charge, you become a floor supervisor over time after experience. You can become a deputy nursing superintendent, an assistant nursing superintendent, a nursing officer, the chief of nursing services. So these terminologies may vary from one state to another, from one hospital to another. But you can rise up your career ladder in the hospital sector. So in the hospital sector, now it's not that you finish your course and you just get to be a deputy nursing superintendent. Since the bedside nursing in particular requires a lot of skills, your promotion comes along once your experience increases. So now we moved off the first option of being a bedside nurse. So moving on to the next, the most simplest choice. So you do your master's and you want to become, a lecturer, assistant professor. You want to become an academic person. So in this line, it's not that only a person who has finished her master's can teach. Bachelors can also teach. But the only thing is that maybe they would prefer a person who has finished her bachelor's to teach primarily in the School of Nursing. Of course, there are many colleges who also recruit teachers with BSc Nursing, but probably when they allocate classes to them, it would be primarily for the general nurses. And, they can also be given classes for the first year BScs, which has more basic courses like fundamentals of nursing, community, sociology, and things like that. And because the third year and fourth year, the BSc students actually move into more specialized lines of education. And so for that, we always prefer a master's, a person who has finished her master's in nursing, but by default, otherwise a BSc can teach. And once you take up your master's, there are different specialties. I think most of you are aware of it. You have medical surgical, you have obstetrics and gynecological nursing. We have pediatric nursing, psychiatric nursing, mental health nursing, community nursing. So you can pick up any specialty of your choice. And, you can concentrate on teaching the third years, the fourth years, the first years. Sometimes it's not necessary that if you finish your master's that you have to only teach third years and fourth years and the PG students. You may also have to teach the first years. So that's the second clear option that everyone takes when they pursue nursing. So other than this, a nurse can also work in a development sector. So if you take me as an example, I was an academic person till May 2023. And after which I moved to a developmental sector. So what is a developmental sector? So developmental sector jobs are more public health jobs. So wherein your task primarily is to work on projects which work on the development of health or the health system, the infrastructure in a country. So that's a nice job opportunity. You may get positions like program officer, senior program officer, state program officer, depending upon your experience, depending upon what the project is looking for in particular. So that's another upcoming area. So you can get into this field by doing your BSc nursing and MSc nursing, or you can also get into this field if you finish your BSc nursing and later pursue masters in public health, masters in health administration, or masters in business admin, an MHA or MBA. So, any of those degrees also can be taken, but it all primarily depends on the type of project they're looking out for a nurse for. They're looking for a nurse for, and your expertise and experience. So that's the third option that a nurse can take up. And after your BSc nursing, again, there are opportunities to take up small courses. There are a lot of certificate programs available. Like, for example, there's something called as a diabetic educator. So, there are certification courses. You look it up on Google. You have quite a number of courses. It's like most of the time it is a day's course or a 3-day certification. And after which you can be a diabetic educator. So what does a diabetic educator do? So most of these corporate hospitals do have a department. And that, India is the second largest country when it comes to the number of people with diabetes. And the number of endocrinologists are not as many. So, diabetes is a lifestyle disease. And a lot of it depends on learning to manage your lifestyle in a better manner. So the primary role of a diabetic educator would involve sitting at the OPD and counseling the patients who are attending an endocrinology or a medicine OPD about the diet, the lifestyle changes, the exercise, how to use your insulin pen, how to self-monitor blood glucose, what should be done, what are the signs of hypoglycemia, what are the signs of hyperglycemia, and things like that. So this is something that you can do even after you finish your to your MSc. But most of the time, once you take your masters, you do not want something as small as to be as being as a diabetic educator. But there are some children or some nursing students who do not have the finance to pursue a higher education. So, but at the same time, they want to do something different. So being a diabetic educator is a good place to start. Now, I have finished finished a certification course in diabetes education, but I do not practice right now. So that's a good opportunity. The next thing that you have is a palliative nurse. So again, any practicing nurse, if she has a BSc or a PCBSc, can take up a certification course by the Indian Palliative Society, which is a palliative course. So these nurses, their job description would be typically at an oncology center or at a particular hospital which has an oncology division, or they would just be along with the oncology unit. So these nurses come for rounds with the palliative doctors. They work just like senior residents or junior residents around the clock. And this palliative course is technically, I think, a 3-day course. And there is also a 10-day course. And you also have a practical session of about 3 months. So once you complete the practical session, so most of the time people take up the certification course, that is just the 3-day or the 10-day course. And once that is over, they don't pursue the practical on-site practical postings. So what happens is that their job technically is, to counsel patients with cancer, their families, maintain the cancer database, and work which is related to, a wound dressing over there, and the problems of handling a patient who is on chemotherapy. But if you finish the practical segment, then you are also eligible to prescribe morphine. So that's, again, a very good area. Then you have something called as the hospital infection control nurse. So again, this is a post that is there in most of the hospitals. So sometimes what happens is that by default, you are a senior nurse, you have been there in the hospital for a long time, they promote you to this post. But there are quite a number of certifications. Again, go on to Google, type in infection control nurse certification program. So again, it varies. It's just like the diabetic educator course. It can vary any day from 3 days to 5 days. And you do the course, and then, you surely have an edge over the other people who have not done the course. Now, once you work in any hospital as an infection control nurse, what happens is the chances of you going abroad is quite higher, because this is again an area where there is a lot of scope of work. Most of the corporate hospitals, the charitable hospitals, the mission hospitals have this role. They're part of the hospital infection control committee. They go around, do clinical audits. They look at the hand hygiene policy in a particular hospital. They kind of also manage or document the number of infections that the patients develop in the hospital. They do research studies or quality audits of things that are happening in the hospital, the waste management. So again, And then they do a lot of presentations. They work closely with the quality team. So the hospital infection control nurse is another good area of work, especially if you're very clinically inclined. So I think most of us are divided into two categories. Some of us belong to both. Some of us are clinically sound, but not theoretically sound. Some of us are theoretically sound, but not clinically sound. But some of us, have the right balance. So you will know what you are passionate about, and you can choose something that fits your idea of what a nurse, who a nurse should be. Now, being an obstetrics and gynecology nurse, and also handling neonates a lot, there's another option called as being a lactational nurse. So the BPNI, and also there is a lactational council abroad. There are courses which are being offered. They're quite a little expensive. The BPNI course, if I'm not mistaken, is about 10,000 rupees in India. And the other course, the same course, which has a foreign equivalent, is a little more costly. And it also has a lot of assignments like, assisting 50 mothers in lactation, counseling so many mothers. Like they have a set of criteria, like you'll have to complete all of it, get it certified and send it back. But once you finish this course, you can practice as a lactational consultant. So if you look at some hospitals, I think most of them are corporate hospitals or charitable hospitals. There is one particular section called as the lactational department, or the lactational department may just be associated with the obstetrics and gynecological department, or it may be as a part of the family welfare department. So your job here technically is to basically assess all women who delivered or antenatal women who are admitted in the hospital who are up for a delivery, teach them about lactation, the various positions. Indian women have issues in terms of, I'm not able to feed my baby properly. What food should I take? What food I should not take? My nipple is flat, my nipple is inverted. So what should I do for it? So this course basically equips you to handle these kind of issues. All kind of lactational issues. Now, a word of advice here: there are people who finish this course and who are Instagram influencers. So they basically have an Instagram page. They take online consultations. There is a particular link, through which you can contact them. They have a consultation time, and there's a lot of things that they can do. And you would be surprised looking at the number of followers these lactation consultants do have. So setting up a clinic may be a little tedious, and there may be a lot of skepticism around it as to, can a nurse start a clinic and stuff like that. But starting an Instagram page, the certification is displayed. So people know that this person is an authentic person, and they do a lot of video consultation. They also do on-site consultations. During COVID, I have worked for some time as a lactational consultant with BEMPU, an organization, wherein it was just online consultations that were being done, wherein, it was just audio calls. I think probably out of the 100 calls that I've taken, just 2 of them asked for video call support, which people are a little skeptical about using a video call for lactational support. But again, this is an area with a lot of scope. It can be done as a freelancing job as well. The next thing is, if you are inclined towards research, you can also work as a research assistant. There are a number of projects. There are a number of research institutes. There are jobs with the ICMR. There are jobs with very well-known established research institutes. So your job primarily, if you are a junior, probably they may send you for data collection. As you grow up in terms of experience, you may be asked to run a project. So again, your post may be anything between, a consultant, a research assistant, research scholar. There are different names again in different organizations. So again, you can finish your BSc for this, and then just have an aptitude for research, complete a few courses on softwares like SPSS, research methodology workshop. You can do those kind of jobs. You can do those kind of courses, or you can just be, after your master's, research is a part of your master's. So if you're just inclined towards research, you can get into jobs, that deals with research. A nurse can also be an ethicist. When I introduced myself, I told you I finished an ethics course. There are a number of ethics courses within India as well. Manipal Institute, CMC Velo offers ethics courses, masters and certificate courses and fellowship courses. So you can get onto those websites, look at the course. And now what is it that you're going to get out of this? This probably cannot be a job by it on its own. But now if you work in a hospital or a college, if you finish this particular course, you can be part of the hospital ethics committee, the IRB approval committee. It will be answer to you in your curriculum vitae. So, that is something that, again, you can take up. As nurses, we all learn psychology, and you can also pursue counseling psychology after your nursing. And again, you can take up jobs of, that are counseling oriented. So again, you know that in India, a lot of awareness is being raised right now around mental health. So that's another area that you can work around. The next job opportunity or the job option that I would like to talk to you about is the school health nurse. So again, with the number of international schools increasing in India, and not just in international schools, even our Kendriya Vidyalayas now have the concept of a school health nurse. So sometimes they will have to be an on-site 24-hour available thing, 24-hour available person. Sometimes it could also be that, it is a 9 to 5 kind of a job. So this particular nurse, there isn't a specific course that a nurse should do. A basic BSc nursing degree should help you get through. But you can also have your master's and then choose to work at a school. It is up to you, because some of us may be passionate about working with the children. So in that case, you can pick up a job as a school health nurse. You should take care of the vaccinations, the health education, the deworming of the children, basic classes on hygiene, first aid of the kids. And things like this can be taught under the heading of, being a school health nurse. So these are some opportunities, but there are a lot of it. If anyone looks at the extended and expanded roles of the nurse, there are plenty. And now, as per the new curriculum that has come up, forensic nursing has been introduced. So once you complete that, there can be options where you actually get into crime cases and work with the team to help in identifying a lot of solutions when it comes to forensic issues. So that's another line of work that I presume that would come up. And also nowadays, all these 5-star hotels have a in-house nurse to take care of the patients. And ideally, even our aviation industry can have the nursing cadre, one nurse per flight. In some foreign countries, this is practiced, but there is an opportunity, a career opportunity there as well. The first set of jobs that I mentioned are more frequently used, are more frequently taken up, and people, and it's practiced more in India. But there are a lot more opportunities which are available, and there is a lot that a nurse can do. With that, I would like to end my presentation by saying that we should never confine ourselves to our traditional understanding of nursing. Always go above and beyond. The world is yours, and there is so much that you can achieve as a nurse, just and only if you are open to explore the various options that are there right in front of your eyes. So I would like to close the presentation by thanking all of you who are there today online watching this presentation. And I'm open to any questions that you would like to ask. I'm very sure that I've just mentioned, quite a few of them, but you may have a lot of questions. I may have missed some options or specialities or type of jobs that, we're looking for. So, I would like to close my presentation at this point. Thank you.
Thank you so much, Monica. We do have a question right now in the YouTube chat. It's by Fusion Mania.
Okay.
It's called, he says that he's a PhD in community health nursing. So what is the scope in the development sector and how to approach the sector to get a job?
Okay. So thank you for the ready. So community health nursing, PhD in community health nursing is as good as a master's in public health. And the only way that you can apply for a job in the developmental sector is to get onto the DevNet website. So you get onto the DevNet website, or you individually get onto specific websites like, Jhpiego has a specific website. WHO has a website where you log in and get their job opportunities mailed to you every time opportunity that suits your profile comes up. UN has a website for the same. But the easiest way to do it is to get onto the DevNet website and look for things that you are interested in. There would be a number of projects and your positions. If you are a fresher in the developmental sector, probably you'll have to start at the level of a program officer or senior program officer, and probably after 2 to 3 months of looking at how you're doing with the public, probably you'll get promoted. And sometimes if you have plenty of experience, in any other department, and then you decide to join, probably you may get a higher position at the first go itself. So I hope I've answered your question.
So Monica, can you tell us a little more about various certifications? Like I know you mentioned a lot of like infection prevention or something, but if like I'm a budding nurse, I'm still doing my graduation, what courses should I focus on doing so that it sort of bolsters and like helps me do my masters or like gives me an extra edge to
Okay.
really prepare myself?
Okay. So one thing is that the number of takers for Masters of Nursing is quite less in the North when compared to the South, the number of people taking up Masters. So to be very truthful, it is not a very stringent entrance. There isn't a stringent process like, to select one over the other. It's quite easy most of the time. Like there's a basic common entrance exam that you have to clear and enter. However, if you are the person, if you are the kind of person to go above and beyond, you can take up any course. Whenever you are in a nursing college, there would be a number of workshops and conferences. But the basic things that I would like a BSc nurse who aspires to do an MSc degree to take up is a research methodology course. Because research is something very new for a BSc nurse. And during the BSc, they do have 1 year, one course allotted to research. But a BSc nurse doesn't give a lot of thought to it. It is just thought of as any other subject. They just want to finish the subject and move on. So keeping that in mind, I think there are a number of research methodology courses by good institutions like Manipal. I'm so sorry I'm mentioning a lot of South Indian institutes. I'm just a little unaware of the North. Manipal, CMC Velo, St. John's Medical College Hospital, Yenapoya, Father Muller's. These institutions offer this research methodology course, which is like normally a 10-day course. And sometimes it may be spread over weeks, like, every Saturday, or sometimes it might be a 10-day course. It's a little expensive, but, doing this is really, a good thing, so that not because she may get selected for her master's, but it will surely ease her master's process a little better. Again, this particular BSc student who's interested in MSc can also take up a course in statistics. Again, these research institutes or these institutions offer short-term research courses, like, the basics of using Excel, the basics of using SPSS, which is again a software for data analysis, which the student will have to do if she takes up her master's. And normally the number of hours allotted for statistics is 40-50 hours. So the teacher would not be able to teach something to a nursing student as to how to use a software. So doing that would surely kind of help her have an edge over other students when it comes to implementing her master's thesis. So that's again something that I would like her to take up. And if, other than that, it's better that she takes up the certificate courses in diabetes, a 3-day lactational workshop. She need not finish a certificate course, but she can just, whenever the opportunity comes, and mostly happens on Saturdays, Sundays. So it's easy for the student to take up. And also, there are quite a number of websites. Like there is a global nursing network, global health nursing network, which offers number of courses on it. And what you have to do is just pick courses that you want. And, it is like a programmed instruction kind of a thing. You have a learning material, and after which you need to do you do a pre-test, go through the learning material and do a post-test. And if you get 85% and above, you are certified. And these courses are certified by WHO, UNICEF, World Bank, things like that. So it gives you a lot of weight over the other people, not probably to enter the course, but surely you will be much more informed as a student in comparison to the other students. So there are a lot of courses available, and it's all, you just need to put a certificate course and you put it on Google and you get plenty.
So Monica, if I can ask, what was your favorite certificate course to take and why?
Okay, so for me, my favorite certificate course was on pediatric bioethics. And this particular course was I just went for a conference. I attended an ethics conference. There were some international speakers over there. And I presented a paper. And after which I got to realize that there is a pediatric bioethics course. These people came to me and asked me, are you interested? So then they sent me the link, which was on their website, and they told me, you just apply. So, every Indian's fear to go study abroad is a lot of money. It becomes a little difficult. But then they also told me there is an option for applying for a scholarship for the same. So, I applied for this particular course, and I got selected. And I think it was such a wonderful experience because the learning style was different. And we were a batch of 50. We had people from nearly 40 different countries on the team. I learned so much about health from different countries. I didn't spend a penny to go to the US, come back, right from my visa to my stay, and everything was covered. And I learned a lot. And after having completed that course, I got a position in my own institution as an adjunct faculty in ethics. I am an adjunct faculty in that particular international university. They normally recruit their students over there as teachers. So again, it opened a lot of opportunities to me. We get to know a lot of things that is happening. We discuss ethical cases. If you remember Ireland, there was one particular Indian woman from Karnataka who was denied abortion, and there was a lot of issues. So we discuss cases, like, we then just dissect it and kind of look at it, and we find solutions to it. So it has raised my bar of knowledge of worldly affairs, and also to critically evaluate it. Otherwise, I would have just looked at it as a news piece. But after having learned the course, I kind of look at it, okay, what is the ethical problem here? This could have been done this way. This should not have been that way. So it has surely raised my level of thinking to, critical thinking has become more a part of my life. And learning from foreign teachers, and learning their style, the way they take classes, the way they are open to your points, has all surely created a lot of impact on me. So according to me, that was the best course. I in fact loved it even more than my PhD. And I had to do a research paper as well there, and I had to present the paper there. So it was just wonderful working with that team.
Monica, would you suggest if you're not like willing to go into academics, like become a professor or a teacher, and you want to go into like a clinical mode, or you want to work in the development sector, would you suggest someone doing a PhD, whether it is like useful like to that level, or would you ask them to do something more practical, like a clinical, like a hands-on course?
Yeah. So a PhD by default doesn't mean that you know everything. And with the number of people and the number of universities offering PhD, I would say that every other person has a PhD today. So the first thing is not to restrict ourselves to the fact that a PhD is a mandate, because if you give money to a person, a PhD degree can be bought, the thesis can be brought to your table, without even getting onto writing and carrying it on. So now, since you asked that question, there's something that I missed out when I was presenting the various options, which is related to your question. Now, some of us are clinically oriented, and I would just want to, be, a senior nursing officer or a nursing superintendent. So there are courses like an NABH course, wherein you can be part of the quality team. So again, the quality managers of a hospital get paid a lot. It is a straight 9 to 5 job, and it primarily deals with improving the quality of the hospital. So finishing an MHA, a Master's in Health Administration, finishing a diploma in hospital administration, or taking up just NABH offers quite a number of courses, 3-day courses, 3 months courses, like, which is scattered over a period of time. So you can do it on job. So you can take up those kind of courses and, rise the clinical lifestyle by just, your experience will eventually add up, because at the clinicals, it's not more, as to, what's on book and you replicating it. It's more about applying what you learned. So that's something that you can do. Having a PhD, if you have put your heart, mind, soul to it, you have done it genuinely, then surely there's a lot that you learn from the PhD, not by your research by itself. The process of handling, the process of being rejected, the patience that you learn brings in a lot of strength and metal to you as a person, which helps you take steps forward. But if you ask me honestly, having a PhD is desirable. It isn't essential. If you have the grit in you, I don't think, a PhD is a mandate. But then, yeah.
Monica, we have 2 more questions from the chat. The first question is by Neelu. She wants to know if a person who wants to join public health and going to like a master's course, how the experience is calculated and what should they do to like improve that kind of experience?
Okay. So if you have finished your bachelor's degree, and from the time you finished your bachelor's degree, you always wanted to want to get into public health, you can start right away. You may get a job which is, not, a job at the basic level, like just like how once you finish your BSc nursing, you'll start as a junior staff nurse. So you will start at that level and gather experience over time. And once your project team kind of feels that you are capable enough to go to the next level, you will be promoted. Having a master's in public health is surely desirable. Now, again, when we learn our nursing curriculum or our syllabus, the emphasis on public health is very less, especially at BSc level. So, learning to work with public health is a little difficult. It takes time, it takes experience. Now, me having about 12 years of academic experience, academic and clinical experience, I come from a dual role system. For me, when I moved to public health, I found it difficult because academics is structured. Everything is in place, systems are in place. But in terms of public health, things are vague. It happens at the drop of a hat, things change. It is dependent on a couple of not a couple of, depends on thousands of people. I mean, so handling them, your communication skills is something that you should work. Maybe be language proficiency, the way you get your point across. You should be a good salesperson, I feel, when you are in public health. It's not about having great points. It's about selling your point across and also being competent enough to complete a project, which is not just totally, in the academic sector, everything is in place. So I think that experience can be garnered by staying in public health for a period of time. But another thing that you have to remember in public health is the job opportunity may not be permanent. It may require a lot of relocation. It may not be as of in academics. See, an academic job will give you 40, 50,000 maximum, but you have job permanency. So again, an Indian household always believes in a permanent job, a government job, rather than a job which expects you to travel a lot, a job that there's no permanency. Like today, you get to know that in 1 week you're going to lose the job, or you have to move from one state to the other. The job by itself is rewarding, very exciting, but it requires a different set of skills in comparison to an academic job, and that can be learned over time on field. Like the person that I was when I entered public health and the person that I am today, I'm happy that I made the choice because it has taught me a different set of skills, and it presents me with different challenges, and it gives you an opportunity to feel that you have done something for the community. So having a master's in public health will surely help you, but you should really be a very smooth person in terms of communication, and you should be an excellent salesperson.
Monica, we from the chat and one we've got from the group text. So Maya Sarath, she's a nurse who has also recently completed her the NPME course for midwifery, and she wants to know whether she would be eligible to do any of the short certification courses that you mentioned earlier.
Yeah. See, about short certification courses, there is no entry criteria. You can do as many courses as you want. There isn't a particular thing that, you should have, a master's in pediatric nursing to do this course. No. Most of these courses are general and it's quite easily accessible, and you are allowed to take up these courses.
So, Monica, last question by Neil Kashmir. She wants to know whether, she has been, she knows someone who has done a nursing master's and has their MPH and has been working as a public health professional for quite some time, like 6-7 years. And now they want to shift into academics.
Okay.
So, whether the public health experience would be counted as like say 6-7 years experience, and would they need to do it?
Okay, so this question is tricky because there is an on-paper policy for this and there is an off-paper policy for this. So technically, as per Indian Nursing Council, if you have development experience, the development sector experience, it would not be calculated as your academic experience. So if I decide to move into the academics after 10 years of developmental sector experience, I would start as a tutor. So that is what is written on paper, and most good established and premier institutions follow this. However, I'm also aware that many institutions in the north and in the south do take people, considering them, okay, fine, 10 years. After MSc, she has 10 years. Okay, let us take her as a lecturer or assistant professor. But once the new NNMC Act gets enforced, I think people will be more strict about it because the skill set is different. The skill set that you require, because having been in the development sector, your work is more spontaneous, more challenging, more, public health oriented. Whereas in the classroom, you need to make a lesson plan, you need to do paper corrections, there is a semester system, you need to know how to evaluate papers. See, I'm not saying that you wouldn't be able to do it, but as per paper, the experience is not supposed to be added. But practically, I have seen institutions where they do take people like that. But it depends upon the institution, and the institution may not be as premier as you think. If you're looking at the premier institutions, they're very particular about who they're taken. They follow the on-paper guidelines to, recruit anyone. But there are other institutions which may take you. So that is something that you need to keep in mind. But you can always go back to teaching, and start as a tutor. Even if you think, surely the experience that you gathered in any profession will surely play some important role in your career. But if you look at it in terms of experience, will they promote me? Is fair in itself. Because as an associate professor, you may have to guide a PG student.
Right.
You would not have looked into a research project in your lifetime after your master's. And how are you expected to guide that student? So,
So, Monica, there is a follow-up question on that. So if you're going from public health to academics, is there a bridge course or a short-term course that can help you bridge that like educational gap?
No, there isn't any bridge course as of now. The person will just, because you are qualified, all you need to do is, you just need to gather that experience to make you a better teacher. So, I think sometimes it is good to mix and match. Do some of your work here and some there. It will give you a lot of experience. You're more open-minded. You know a lot of things rather than being like a horse that is, looking in one direction.
That sounds great, Monica. Thank you so much for today's session. We don't have any more questions for you today, but in case the audience is watching us, please leave your questions in the chat and we'll try and get back to you through the Mission Niramaya Twitter handle. Thank you so much for joining us today. And thank you so much for the excellent guidance that you have given out the students. We'll log off for today. Thank you so much. All right.
Thank you. Thank you.